The woman in bed 7 was dying, and everyone kept saying how lucky she was. So lucky her husband was home when she fell, the day shift nurse said. So lucky she got here within the golden hour, the attending remarked during rounds. So lucky she has such a devoted spouse, the social worker added, watching through the glass as the man in the expensive suit held his wife's hand. I stood at the nurse's station in the ICU, staring at the chart on my tablet, and felt my stomach turn, because I just read the imaging report. I'd seen the x-rays, the CT scans, the evidence written in bone and tissue, and nothing about what I was seeing looked like luck. The fractures were too systematic, too precise, the pattern of injuries too deliberate. And when I looked up at the man holding his unconscious wife's hand, the man everyone called devoted, the man who'd rushed her to the hospital, the man who'd stayed by her bedside for 3 days, I saw something in his eyes that made my blood run cold. He was smiling, not the smile of someone relieved their loved one had survived, the smile of someone who was waiting for her to die. And when I approached him later that morning to discuss the surgery she desperately needed, the surgery that could save her life, he looked me straight in the eye and said 5 words that changed everything. I'm not paying for that. It was a Wednesday morning in late November when Amanda Preston arrived at St. Halsted Hospital's trauma bay. The kind of crisp autumn morning where you could see your breath in the parking lot, where the sun hung low and golden, where everything felt clean and new despite the exhaustion pulling at my bones. I was 6 hours into my ICU rotation second year of residency, still figuring out how to function on 4 hours of sleep and too much coffee, when the overhead speaker crackled to life. Trauma incoming. ETA 3 minutes. 34-year-old female. Fall from height. Multiple injuries. GCS8. Prepare for intubation. I'd been reviewing labs at the nurse's station, trying to stay awake, trying to make sense of a potassium level that didn't match the clinical picture. My coffee had gone cold in its paper cup. My white coat had a stain on the sleeve from where I'd brushed against something in the supply room earlier. My stethoscope felt like it weighed 10 pounds around my neck, the metal cold against my skin even through my scrubs. This was residency. This was what I'd signed up for. 80-hour weeks that felt like 100. Decisions made through a fog of exhaustion. The constant awareness that someone's life depended on you getting it right, even when your brain felt like it was wrapped in cotton and your eyes burned from lack of sleep. I grabbed my trauma gown from the supply cart and headed to the bay, my legs heavy, my movements automatic from months of repetition. The attending on duty was Dr. Lisa Martinez, a sharp-eyed intensivist in her early 50s, with silver-streaked hair pulled back in a tight bun. She had a reputation throughout the hospital: brilliant, demanding, uncompromising. The kind of doctor who'd spent 20 years in critical care and had developed an almost sixth sense for when something wasn't right. Residents either loved her or feared her, sometimes both at once. She was already gloved and gowned when I arrived, her dark eyes scanning the trauma bay with the focused intensity of a hawk. The room was a study in organized chaos, everything in its place, everything ready for the worst. Monitor cables coiled neatly, oxygen tubing checked and rechecked, crash cart positioned within arm's reach. 2 nurses flanked the empty bed. Rita, a woman in her late 50s who'd been working the EO for 20 years and had seen everything twice. And James, a newer nurse in his mid-20s with steady hands and a calm demeanor that belied his relative inexperience. "What do we know?" Dr. Martinez asked the charge nurse without looking up from her preparation. "Not much," Rita said, her fingers already moving to check the monitor connections one more time. Dispatch said she fell down a flight of stairs at home, basement stairs. Husband called 911. Paramedics found her at the bottom, unconscious but breathing. Vitals? Blood pressure was low on scene, 85/50. Heart rate in the 120s. Respiration shallow at 24 per minute. They started 4 fluids en route. Good, let's be ready for anything. The automatic bay doors burst open with a pneumatic hiss, and the ambulance backed in, its lights still flashing red and blue against the pale morning light filtering through the high windows. The driver's side door opened first, and the paramedic jumped out, A young guy with dark hair and tired eyes that suggested this was his 4th or 5th call of an already long morning shift. The back doors of the ambulance opened, and 2 more paramedics helped guide the gurney out. On it was a woman young, maybe mid-30s, with blonde hair that had probably been pulled back in a ponytail before it got matted with blood. She was dressed in black yoga pants and a gray t-shirt that had probably been white before it got soaked with blood from the gash on her head. Her face was swollen, already bruising in shades of purple and yellow. An oxygen mask covered her nose and mouth, fogging with each labored breath. Her left arm was bent at an unnatural angle, the wrist turned in a way that made my stomach clench. Amanda Preston, 34 years old, the lead paramedic reported as they transferred her to our bed with practiced synchronization. The movement smooth despite the urgency. Fell approximately 15 feet down basement stairs. Found unconscious by husband at the bottom. Initial GCS was 12 on scene, confused, but responding to verbal commands. Dropped to 8 en route now, only responding to painful stimuli. Blood pressure 90/60 after 1 liter of normal saline. Heart rate 118. Respirations 24 and shallow. Obvious head trauma with active bleeding from scalp laceration. Possible rib fractures based on palpation. Patient grimaced when we assessed the left chest. Left arm deformity consistent with displaced fracture of the radius and ulna. Pupils? Dr. Martinez asked, already at the bedside with her pen light out. Her movements quick and efficient. Unequal when we arrived on scene about 20 minutes ago. Right is 4 millimeters and sluggish to react. Left is 6 millimeters and non-reactive. That's worse than when we picked her up. That single piece of information sent a jolt of adrenaline through my exhaustion, burning away the fog. Unequal pupils after head trauma was bad. Really bad. It meant blood was accumulating inside the skull, creating pressure, pushing the brain to one side, compressing vital structures that controlled consciousness, breathing, life itself. It meant we were running out of time. Every minute that passed, more brain cells died. Every minute that passed, the pressure built higher. Let's intubate, Dr. Martinez said, her voice calm but with an edge of urgency that made everyone move faster. Coleman, you're up. We need to protect this airway now before her mental status deteriorates further. My hands moved automatically to the intubation tray, muscle memory from months of training taking over. I grabbed the laryngoscope, my fingers checking the light bright, functioning. I selected the appropriate sized blade Mach 3, standard for an adult female. I chose an endotracheal tube 7.5 millimeters, appropriate size. I checked the cuff, inflating it to make sure there were no leaks, then deflating it again for insertion. I'd done this dozens of times in simulation, a handful of times on real patients under supervision. But it never stopped being terrifying holding someone's life in your hands, knowing that one mistake, one moment of hesitation, 1 millimeter off in your placement could mean permanent brain damage or death. The weight of that responsibility never got lighter, no matter how many times you did it. I positioned myself at the head of the bed, standing where I could get the best angle. Rita was already at my side, anticipating what I'd need. Suction ready, she said quietly. Backup tube ready. Bougie ready if you need it. I tilted Amanda's head back carefully, not too much, because of the potential cervical spine injury, but enough to open her airway. I opened her mouth and looked inside. Blood pooled in her airway, dark and thick. I suctioned it out, the wet gurgling sound making my stomach turn. I inserted the laryngoscope blade, sliding it over her tongue, moving slowly but steadily. I visualized the epiglottis, that small flap of tissue that protects the airway. I lifted it gently, and there, the vocal cords opening and closing with each breath like a gateway. I threaded the endotracheal tube through in one smooth motion, watching it pass between the cords, watching it disappear into the trachea. I inflated the cuff to seal the airway. I removed the laryngoscope and stepped back. "Tubes in," I said, my voice steadier than I felt inside. The respiratory therapist, a woman named Sarah who'd worked at St. Halsted for 15 years, connected the ventilator with practiced efficiency. The machine began breathing for Amanda with rhythmic precision. The capnography monitor showed the characteristic waveform, confirming proper placement. The tube was in the lungs, not the esophagus. Good placement, Dr. Martinez confirmed, moving her stethoscope across Amanda's chest to listen to lung sounds. Equal bilaterally. Nice job, Coleman. Let's get a portable chest X-ray to confirm, and then straight to CT. I want to see what we're dealing with inside that skull. As the team prepared Amanda for transport, securing 4 lines, adjusting ventilator settings, making sure all the tubes and wires were organized, a man burst through the trauma bay doors. He was tall, maybe 6'1" or 6'2", well built in a way that suggested regular gym visits rather than manual labor. He was dressed in charcoal gray slacks and a light blue button-down shirt that probably cost more than my monthly student loan payment. His hair was perfectly styled, not a strand out of place despite the supposed emergency. His watch caught the light, a Rolex, I noted automatically, the kind that cost as much as a used car. His shoes were Italian leather, polished to a mirror shine. But it was his face that struck me. His eyes were red and slightly swollen, like he'd been crying. His expression was a perfect mask of worry and fear, every line of his face conveying devastated concern. He looked like the picture of a devoted, terrified spouse arriving to find his wife in a trauma bay. "Where's my wife? Is she okay?" They wouldn't tell me anything in the ambulance. I tried to ride with her, but they said there wasn't room and I had to follow. In my car, and I've been going crazy not knowing. "Sir, are you family?" Dr. Martinez asked, stepping between him and the bed, her body language professional but protective. "I'm her husband, Michael Preston. Please, is Amanda going to be okay? What happened? Is she going to live?" His voice cracked on her name. His hands were shaking. I could see them trembling as he reached out toward the bed where Amanda lay unconscious. He looked like every worried spouse I'd seen in my 2 years of residency. He looked genuine. He looked devastated. But something about him bothered me, something I couldn't quite articulate. Maybe it was the way his clothes were so perfect, despite the emergency. Maybe it was the way his hair wasn't messed up at all. Maybe it was just exhaustion making me paranoid. "We're taking her for imaging now," Dr. Martinez said, her tone professional but kind, the voice she used with worried family members. "She's stable for the moment, but she has significant injuries. I'll be able to tell you more once we see the scans and understand the full extent of the damage. Can I come with her? I need to be with her, not into the CT suite, I'm afraid. The radiation exposure wouldn't be safe, and we need the space to work. But you can wait right outside the radiology department. Dr. Coleman will stay with you and answer any questions you have about Amanda's condition and what we're doing for her." Dr. Martinez shot me a look that said, "Pay attention to this man. Watch him carefully. Ask questions. See if his story holds together." I nodded and gestured for Michael to follow me. As we walked through the corridors toward radiology, our footsteps echoing on the polished linoleum floor, Michael kept up a steady stream of anxious chatter. His words tumbled over each other, painting a picture of a normal Wednesday morning shattered by sudden tragedy. "I don't understand how this happened. Amanda's always so careful. She's been going up and down those basement stairs for 5 years. We've lived in that house since we got married. She knows every step, every turn, every place where the wood creaks. She knows to hold the railing. God, I've told her 1,000 times to hold the railing, especially when she's carrying things. I'm always telling her to be more careful." "Mr. Preston," I interrupted gently, trying to slow down his verbal flood. "Accidents happen, even to careful people, even in familiar places. The important thing is that she got help quickly. You calling 911 immediately, that probably saved her life. The first hour after a traumatic injury is critical." I was in the kitchen making breakfast. He continued, barely acknowledging my words, his eyes distant as he recounted the morning. "We were supposed to go to brunch with friends today. Some couple Amanda knows from her yoga class. She's really into yoga. Does it 4 times a week, very health conscious. I was making scrambled eggs, her favorite, with cheese and chives, the way she likes them. And I heard this sound, this terrible crash, and then just ... silence. Just complete silence. And that silence was worse than the crash, you know. because I knew something was wrong. His voice broke convincingly. I ran to the basement door and looked down, and I saw her at the bottom of the stairs. She was just lying there, not moving. There was so much blood. Her head was bleeding, and I could see her arm was bent wrong, bent at an angle that arms shouldn't bend, and she wasn't moving, wasn't responding. I thought she was dead. I honestly thought my wife was dead. But you called 911 immediately, I prompted, watching his face carefully as he recounted the story. Yes, of course. I didn't know what else to do. I wanted to run down there, to hold her, to do something. But I remembered reading somewhere, I think it was in a magazine article, or maybe online, that you're not supposed to move someone with a head injury or a neck injury, that you could make it worse, could paralyze them or something. So I just stood at the top of the stairs and called for help. And it felt like the longest 9 minutes of my life, waiting for the ambulance. Just standing there, helpless. But you didn't stay at the top of the stairs the whole time, I said, testing him. The paramedic said she was found with someone holding her hand. Oh, right. Yes. After I called 911, after they said help was coming, I couldn't just stand there anymore. I had to go to her. So I went down the stairs carefully, so carefully, because I didn't want to fall too, and I knelt beside her. I didn't move her, didn't touch her head or her back, but I held her hand. I talked to her. I told her to hold on, that help was coming, that I loved her, that she was going to be okay. We reached the radiology department. Through the large window, I could see the CT scanner, sleek and white like something from a science fiction movie. The technicians in their lead aprons, preparing for Amanda's arrival. Mr. Preston, while we wait for the scans to be done, I need to ask you some questions about Amanda's medical history. It'll help us treat her more effectively if we know about any underlying conditions or previous injuries. Of course, anything, whatever you need to know. I pulled out my tablet, opening Amanda's electronic medical record. Does she have any chronic medical conditions? Diabetes, heart disease, high blood pressure, anything like that? No, nothing. She's completely healthy. Very healthy, actually. Like I said, she does yoga 4 times a week, hot yoga, which is supposed to be really good for you. She runs on weekends, usually 5 or 6 miles, sometimes more. She eats really well, mostly vegetarian, lots of vegetables and whole grains. She's always been the healthy one in our relationship. I'm the one who needs to watch my cholesterol and blood pressure. He gave a weak laugh that sounded forced, practiced. Any medication she takes regularly? Just vitamins. A multivitamin every morning. Vitamin D because her levels were a little low when she had blood work done last year. And birth control pills were not ready for kids yet. Maybe in a couple of years when we're more established financially. I typed notes as he spoke, my fingers moving across the tablet screen. Any allergies? To medications or anything else? No, nothing. She's never had a reaction to any medication that I know of. Any history of falls or injuries before today? Michael hesitated. It was brief, maybe half a second, a barely perceptible pause, but I noticed it. I'd been trained to notice those micro expressions, those tiny tells that indicated someone wasn't being entirely truthful or was carefully considering their answer. A slight tightening around his eyes, a barely visible tension in his jaw. No, nothing like this. Has she ever broken any bones? Sprained anything? Any trips to the emergency room? No, she's really been very healthy, very lucky, until today. His voice caught. God, I can't believe this is happening. This morning, everything was normal. We were talking about brunch, about what we'd order. She was laughing about something. And now ... Mr. Preston, I notice in her medical record that she visited an urgent care clinic about 18 months ago for a wrist injury. Do you remember that? Another hesitation, longer this time. Oh, that. Yes, I'd forgotten about that. It wasn't serious. Can you tell me what happened? She was jogging. On the trail near our house, there's a nice nature trail that goes through the woods, about 3 miles long. She said she tripped on a root or a rock or something and caught herself with her hand when she fell. Her wrist hurt for a few days, but it healed up fine. And there was another visit about 2 years ago to the emergency room for an ankle injury. That was at our house, Michael said. his tone becoming slightly defensive, slightly irritated. She was carrying groceries up from the garage. We have a few steps leading from the garage to the kitchen. She was carrying too many bags at once. She always does that. Never wants to make 2 trips, and she tripped, twisted her ankle pretty badly. But again, it healed fine. She was back to normal in a couple of weeks. So both of those previous injuries involved falls, I said carefully, watching his reaction. And now this. 3 falls in 2 years. Amanda's clumsy, Michael said, a hint of frustration creeping into his voice now. She's always been accident-prone. She trips over her own feet. She bumps into things. She's not the most coordinated person. I love her, but she's not graceful. She's always getting little bruises from bumping into furniture or doorways. I tease her about it sometimes. Tell her she should bubble wrap herself before leaving the house. I made careful notes on my tablet, marking the inconsistencies in my mind. A woman who did hot yoga 4 times a week and ran 5 or 6 miles on weekends wouldn't typically be described as clumsy or uncoordinated. Those activities required significant balance, body awareness, spatial orientation. You didn't successfully complete an hour of hot yoga holding complex poses while your muscles were stressed and your body was dehydrated from sweating if you were naturally accident-prone. Mr. Preston, you mentioned you were in the kitchen when Amanda fell. How far is the kitchen from the basement door? Maybe 20 feet. The kitchen is open to the living room, and the basement door is off the living room. Why does that matter? I'm just trying to understand the timeline. So you were making breakfast at the stove, which means you had your back to the basement door. Yes, I suppose so. I was standing at the stove scrambling the eggs. And how long was it between when you last saw Amanda and when you heard her fall? Michael's expression shifted again, just slightly, but I caught it. A tightening around his eyes, a tension in his jaw. I'm not sure, maybe 5 minutes? 10? She'd gone down to the basement to start a load of laundry. We always do laundry on Wednesday mornings before we go out. It's part of our routine. And in that 5 or 10 minutes, you didn't hear anything from the basement. No sounds of her moving around, putting clothes in the washer? No, but the basement door was probably closed. We usually keep it closed because we have cats and we don't want them going down there and getting into things. But you heard her fall through a closed door? It was a loud noise, a very loud crash. And you said you didn't hear anything before the fall? No cry, no exclamation, no warning? Michael's expression was becoming guarded now, his friendly demeanor slipping slightly. No, just the sound of her falling. Why are you asking me all these questions? What does this have to do with treating her? Shouldn't you be focusing on helping her instead of interrogating me? I'm just trying to get a complete picture of what happened, Mr. Preston. Understanding the mechanism of injury helps us anticipate potential complications and provide better care. It's standard protocol, but that wasn't entirely true. I was looking for inconsistencies, for gaps in his story, for anything that might suggest this wasn't the straightforward accident he claimed it was. And I was finding them. Small things, subtle things, but they were adding up. Before I could ask another question, my pager went off, vibrating against my hip. I pulled it out and looked at the message. Patient in ICU, CT complete. Come to reading room immediately. Mr. Preston, I need to go look at your wife's scans. Someone will come out to update you as soon as we know more. How long will that take? Maybe 30 minutes to an hour. We need to review the images carefully. Can I see her after that? Probably. Once she's settled in the ICU, I left him standing by the window, staring at the CT scanner where his wife was being imaged. And I couldn't shake the feeling that I'd just been listening to a very carefully rehearsed performance. The CT results were waiting when I arrived at the radiology reading room. Dr. Martinez was already there, sitting at the workstation, her eyes fixed on the large monitors displaying the black and white images of Amanda Preston's battered body. Coleman, good. Close the door and come look at this. I closed the door behind me and moved to stand beside her. The reading room was small, dim, designed to optimize viewing of the medical images on the screens. Dr. Martinez clicked through the scans with practiced efficiency, and with each new image, my stomach sank further. Subdural hematoma, Dr. Martinez said, pointing to a white crescent of blood visible on the brain scan, pressing against the gray tissue like a malevolent moon. Right hemisphere, significant at least 30 to 40 ccs of blood. Significant mass effect. Look at how the midline structures are shifted. She drew a line on the screen with her finger, showing how the brain's normal central line was pushed several millimeters to the left. She's going to need surgery to evacuate it, and soon. This isn't going to resolve on its own. How soon? I asked, already knowing the answer wouldn't be good. Within the next 2 to 3 hours, ideally. The longer we wait, the more brain tissue dies from the pressure and lack of oxygen, the worse her outcome. This is a race against time, Coleman. Every minute counts. She clicked to the next series of images, scrolling through slices of Amanda's chest. 3 broken ribs on the left side, ribs 8, 9, and 10. Clean breaks, complete fractures. And look here. She pointed to a dark space between the ribs and the lung. Pneumothorax. The broken rib punctured her lung. We'll need to put in a chest tube before surgery to re-expand the lung. She continued clicking through images. Fractured radius and ulna in the left forearm. Displaced fractures. The bones are completely separated and out of alignment. She'll need orthopedic surgery on that too, but that can wait until after the brain surgery. The brain is the priority. I studied the images carefully, my exhaustion forgotten as my clinical mind engaged fully. Something was bothering me, an itch at the back of my brain that I couldn't quite scratch. I zoomed in on the rib fractures, examining them closely. Dr. Martinez, can I show you something? She leaned back in her chair, giving me space. What am I looking at? These rib fractures. They're all on the left side of her body, all in roughly the same location along the posterior axillary line, the back of her rib cage, along the side. The fracture lines are clean, distinct, running perpendicular to the long axis of the ribs. Okay, what's your point? What's her mechanism of injury again? Fall down stairs. Basement stairs, approximately 15 feet from top to bottom. From standing at the top of the stairs? That's what the husband said. She was at the top, lost her balance somehow, fell to the bottom. I zoomed in further on the rib images, rotating them to show different angles. If she fell down the stairs, tumbling and bouncing, rolling down 15 feet of wooden steps, I'd expect more variability in the injury pattern. Some anterior fractures from hitting the edge of steps face first. Maybe some right-sided injuries from bouncing off the wall or railing. Injuries at different levels, different angles. But this, I traced the pattern with my finger. This looks more like focal, repeated trauma to one specific area. Like someone kicked her or struck her repeatedly in the same spot while she was lying down. Dr. Martinez's expression sharpened. The look she got when a clinical puzzle started coming together. When disparate pieces of information suddenly formed a coherent but disturbing picture. You're right. I should have seen that immediately. This pattern is more consistent with direct force applied repeatedly to that specific anatomical location. Like being kicked while she was lying at the bottom of the stairs, or punched, or struck with an object, or stomped on. She pulled up the head CT again, manipulating the images to show different angles, to see the injury from every possible perspective. Look at this. The subdural is right-sided. The blood collection is in the right hemisphere of the brain. But the external injury, the scalp laceration that was bleeding when she arrived, is left-sided. That's a classic contre-coup injury pattern, which would happen if she fell and hit the left side of her head. I said slowly, working through the biomechanics in my mind, visualizing the physics of the injury. The initial impact on the left side would cause the brain to bounce inside the skull from the sudden deceleration. The brain would slam against the right side of the skull from the rebound effect, causing injury on the opposite side from the impact. Contre-coup. But, Dr. Martinez said, her voice hard now, it would also happen if someone struck her on the left side of her head with enough force to cause the brain to slam against the right side of the skull from the acceleration-deceleration forces. The blow itself might cause the external injury on the left, while the brain injury appears on the right from the rebound effect. The implications hung heavy in the air between us. The reading room suddenly felt smaller, the air thicker. We weren't just looking at a tragic accident. We might be looking at evidence of assault, of attempted murder. You think someone hit her, I said quietly, even though we were alone in the room, even though no one could hear us. I think the injury pattern is concerning enough to warrant further investigation. Dr. Martinez pulled up Amanda's electronic medical record, her fingers flying across the keyboard with practice speed. Let's see if there have been any previous visits, any pattern of injuries that might support what we're thinking. We scrolled through her chart. It was relatively sparse for someone her age, a few routine annual checkups with unremarkable findings. A couple of visits to her primary care physician for minor ailments like bronchitis and a urinary tract infection. Normal stuff. And then, buried in the history section, a visit to an urgent care clinic 18 months ago for a right wrist sprain. Diagnosis: wrist sprain. Treatment: ice, compression, NSAIDs. X-ray ordered. A visit to the emergency room 2 years ago for a left ankle sprain. Diagnosis: ankle sprain. Treatment: Rice protocol, crutches, follow-up in 1 week. 2 orthopedic injuries in 2 years. Dr. Martinez noted, her voice tight with controlled anger. Both explained as accidents, both involving falls. Let's look at the details more carefully. She clicked on the wrist sprain visit. The note from the urgent care physician was brief, almost dismissive in its brevity. 34-YO female presents with right wrist pain. Reports falling while jogging on trail near her home. Patient states she caught herself with right hand when she fell. Physical exam reveals tenderness over radial styloid process. Good range of motion with pain. Mild swelling. No deformity. X-ray ordered to rule out fracture. Dr. Martinez pulled up the X-ray images from that visit, the ones taken 18 months ago. At first glance, they looked normal. The bones of the wrist appeared intact, properly aligned. But then Dr. Martinez adjusted the contrast and brightness, manipulating the image to enhance subtle details, and zoomed in on a specific area. There, she said, pointing to a thin line running through the distal radius, barely visible against the background bone. Hairline non-displaced fracture. This was read as negative by the radiologist who reviewed it, probably because the fracture line is so fine and the bones remained in proper alignment. It's an easy miss, especially on a quick read in an urgent care setting, but it's there. You can see it clearly once you know what you're looking for. So she actually broke her wrist, not just sprained it, and either the doctor missed it because the radiologist's report said no fracture, or ... Martinez trailed off, but I understood what she wasn't saying. Or someone prevented her from getting proper follow-up care. Or someone convinced her not to pursue additional imaging that would have caught the missed fracture. Or someone made sure she didn't come back for the recheck appointment that would have revealed the truth. She clicked on the ankle sprain visit from 2 years ago. The A note was similarly brief. 34-YO female presents with left ankle pain and swelling. Reports tripping on stairs at home while carrying groceries. Physical exam reveals swelling and tenderness over lateral malleolus. Unable to bear weight. X-ray shows no acute fracture. Diagnosis: Grade 2 ankle sprain. Treatment: Rice protocol, crutches, follow-up with orthopedics in 1 week if not improving. Stairs again, I noted, my voice quiet. That's the second injury involving stairs at home. And now this. A third fall, this one nearly fatal. Dr. Martinez pulled up the trauma X-rays we'd just taken, placing them side by side with the old images for comparison. Coleman, I've been doing this for 20 years. I've been a trauma surgeon and intensivist for 2 decades. I've seen thousands of accidents, hundreds of domestic violence cases. I've developed an instinct for patterns, for things that don't add up. And this, she gestured at the screen, at the collection of images spanning 2 years. This has all the hallmarks of intimate partner violence. The husband seems genuinely concerned, I said, playing devil's advocate, even though I'd had my own doubts. He was crying. He seemed devastated. They always do. Dr. Martinez interrupted, her voice hard with the weight of experience, with the memory of too many cases like this one. I've seen it dozens of times. Hell, I've seen it hundreds of times. The devoted spouse who rushes their partner to the hospital, who cries real tears, who shows all the right emotions, who says all the right things. And then you look at the injury pattern, you look at the history, and nothing adds up. The explanations don't match the physical evidence. The timing is suspicious. The escalation is clear to anyone who knows what to look for, but we don't have proof. No, we don't. Not yet. Not the kind of proof that would stand up in court. But we have a responsibility to investigate, to make sure this patient is safe. Because if we send her back to an unsafe home environment, if we discharge her back to the person who hurt her, and she dies, that's on us. That's on our conscience. That's on me for the rest of my career, for the rest of my life. Dr. Martinez stood up, her decision made, her course of action clear. I'm ordering a full skeletal survey, complete full-body x-rays, every bone from skull to toes. I want to see if there are any old fractures we don't know about, any pattern of previous injuries that wasn't properly documented, any evidence of chronic abuse. And I'll talk to the husband again, I said. See if his story stays consistent when he tells it a second time. See if there are any contradictions, any details that change. Good. But Coleman? Dr. Martinez's voice became serious, almost grave. Be careful. If he is abusive, if this woman's injuries are the result of domestic violence, then confronting him directly could put both you and the patient in danger. Abusers are dangerous when they feel cornered, when they think their control is slipping. We need to be strategic about this. We need to gather evidence quietly, involve the authorities, build an airtight case, and make sure we have all our facts straight before we make any direct accusations. Understood. As I left the reading room, my mind was spinning with the implications. Michael Preston had seemed so genuine, so worried, so devastated by what had happened to his wife. But I'd learned in my 2 years of medical training that appearances could be deceiving, that the most dangerous people were often the most charming, the most convincing, the best actors. That evil didn't always announce itself with obvious signs. Sometimes it wore an expensive suit and cried real tears and said all the right things, while secretly hoping the person in the hospital bed would die. I thought about Amanda Preston, unconscious on a ventilator, her brain swelling, her life hanging by a thread. I thought about the pattern of injuries scattered across her body like a roadmap of suffering, like breadcrumbs leading back to a truth she'd been too afraid to speak. I thought about the 2 previous accidents that had brought her to medical care, and how close she might have been to speaking up, to asking for help, before something or someone silenced her again. And I made a decision. Whatever it took, however uncomfortable it made me, however many difficult conversations I had to have, I was going to find out the truth. Because Amanda Preston deserved that much. Because every patient deserved that much. Because this was why I'd become a doctor, not just to treat diseases and mend broken bones, but to protect the vulnerable, to speak for those who couldn't speak for themselves, to stand between my patients and the things that threatened them, even when the threat came from inside their own homes. Especially then. I found Michael Preston in the ICU waiting room, a space designed to be comforting, but that always felt sterile and impersonal, despite the designer's best efforts. Pale blue walls that were supposed to be calming, uncomfortable chairs with thin cushions that no one could sit in for more than 30 minutes without their back hurting. Outdated magazines scattered on side tables, issues from 6 months ago, with articles no one cared about anymore. A coffee machine in the corner that produced barely drinkable sludge that tasted like burnt rubber, but that desperate. Family members drank anyway because it was hot and caffeinated and gave them something to do with their hands. He was pacing near the window that looked out over the parking lot, his phone pressed to his ear, his voice low and controlled. When he saw me entering the room, he ended his call abruptly, almost too abruptly, like he didn't want me to overhear what he was saying. "That was my office," he said, slipping his phone into his pocket. "I had to cancel all my meetings today. I'm supposed to be presenting to a major client this afternoon, but obviously I can't do that now. How is she? Can I see her? Have the scans come back? What did they show?" The questions came rapid fire, tumbling over each other, and I held up a hand to slow him down. "Mr. Preston, let's sit down. I need to tell you what we found." His face went pale, and for a moment, I saw something flicker across his expression. Fear? Relief? I couldn't tell. It was gone too quickly. We sat in two of the uncomfortable chairs, facing each other. I pulled out my tablet, more as a prop than because I needed to refer to notes. I'd memorized everything about Amanda's case in the hour since we'd admitted her. "Your wife has bleeding in her brain," I began, watching his face carefully. "It's called a subdural hematoma. There's blood collecting between her brain and her skull, and it's creating pressure that's compressing vital brain structures. She's going to need emergency surgery to evacuate that blood and relieve the pressure." Michael's face crumpled in what looked like genuine anguish. "Surgery? Brain surgery? Oh God, how serious is it? Is she going to die?" "Without the surgery, yes. The pressure will continue to build, and she either have a stroke or her brain will herniate. That's when the brain tissue is forced through the opening at the base of the skull. Either way, without surgical intervention, she won't survive. But with the surgery, she'd be okay." His voice was desperate, pleading, the voice of someone begging for hope. "It improves her chances significantly. The surgery itself has about a 90% success rate in terms of the patient surviving the procedure. But I need to be honest with you, there are always risks with brain surgery: infection, bleeding, stroke, seizures, permanent neurological damage, memory problems, personality changes. We won't know the full extent of her recovery. We won't know if there's been any permanent damage to her cognitive function until after the surgery, when she wakes up and we can assess her." Michael sank deeper into the uncomfortable chair, his head in his hands, his shoulders shaking. For a long moment, he didn't speak. Then, his voice muffled by his hands. "This is my fault. I should have been with her. I should have been watching her more carefully. I should have made sure she was safe. If I'd just been there, if I'd just been in the basement with her. Mr. Preston, this isn't your fault. Accidents happen, even in our own homes, even to careful people in familiar places." He looked up at me, and I saw something flicker in his eyes again, something I couldn't quite identify. Calculation? Relief? It was gone too quickly for me to be sure. "You're right," he said, his voice steadier now, more controlled. "It was an accident. Just a terrible, terrible accident. Amanda's always been a little clumsy. I've tried to get her to be more careful, to slow down, to not try to do so many things at once. But she insists on rushing around, doing 10 things simultaneously, never wanting to make 2 trips when she can carry everything at once. That's just who she is. God, I don't even know what tense to use anymore." He gave a sad smile that didn't reach his eyes. And I felt that prickle of wrongness again, that sense that something about this situation didn't add up. I opened my tablet, pulling up my notes. "Mr. Preston, can I ask you some more questions? About Amanda's medical history? It might help us understand if there's an underlying condition that makes her prone to falls, an inner ear problem, or low blood pressure, or medication side effects, anything like that. Of course, anything that helps." "The sprained wrist from 18 months ago. You said you don't remember any other injuries earlier, but do you recall that one clearly?" Michael nodded, his expression thoughtful, like he was reaching back into his memory. "Yes, she was jogging on the trail near our house she usually runs on weekends, Saturday and Sunday mornings, gets up early before it gets too hot. She said she tripped on a root or something and caught herself with her hand. She was in pain for a few weeks, had to wear a brace, but it healed up fine eventually. She was back to yoga within a month. Did she see a doctor after the urgent care visit? Any follow-up appointments?" "No, I don't think so. They told her it was just a sprain, nothing serious. Told her to rest it and take ibuprofen and ice it regularly. She did all that. Why? Is there something wrong with how it healed?" "Just gathering information." "And the ankle sprain from 2 years ago?" "That was at our house. She was carrying groceries up from the garage. We have 3 steps leading from the garage to the kitchen. And she was carrying too many bags at once. She always does that, never wants to make 2 trips. She tripped on the 2nd step and twisted her ankle pretty badly. Swelled up like a balloon. She was on crutches for a week or so. Again, they said it was just a sprain, nothing broken. So both previous injuries involved falls. I said carefully, keeping my voice neutral, non-accusatory. One while jogging, one on stairs at home. And now this another fall on stairs at home. 3 falls in 2 years. Does that seem like a lot to you? Michael's expression shifted just slightly, but I caught it. A tightening around his eyes. A defensiveness creeping into his posture. Amanda's clumsy. I told you that already. She's always been accident-prone. She trips over her own feet. She bumps into things. She's not the most graceful person in the world. I love her deeply, but coordination is not her strong suit. She's always getting little bruises from bumping into furniture or doorways or the corners of counters. I tease her about it sometimes. I tell her she should wear bubble wrap or protective padding before leaving the house. He laughed, but it sounded forced, hollow. I made careful notes on my tablet, marking the inconsistencies in my mind, the things that didn't quite fit. A woman who did hot yoga 4 times a week holding complex poses that required significant strength, balance, and body awareness, and who ran 5 or 6 miles every weekend wouldn't typically be described as clumsy or uncoordinated. Those activities selected for coordination, for spatial awareness, for an innate sense of where your body was in space. You didn't successfully complete an hour of hot yoga in a room heated to 105 degrees, with your muscles stressed and your body dehydrated from sweating, if you were naturally accident-prone. But I didn't point that out. Not yet. I was still gathering information, still building a picture. Mr. Preston, you mentioned earlier that you were in the kitchen when Amanda fell. Can you walk me through the timeline again? I want to make sure I have all the details right for the medical record. Sure. What do you want to know? What time did you wake up this morning? Around 7, maybe 7:15. I had my alarm set for 7, but I might have hit snooze once. And Amanda? She was already up. She's an early riser, usually wakes up around 6:30. She likes to have quiet time in the morning, drinks her coffee, reads the news on her tablet. So when you woke up at 7:15, where was she? In the kitchen, I think. Or maybe the living room. I'm not sure exactly. I went straight to the shower. And after your shower, I got dressed and went to the kitchen. Amanda said she was going to do laundry before we went out to brunch. So she went down to the basement, and I started making breakfast. What time was that? Maybe 8, 8:30? I didn't really look at the clock. And how long was it between when she went downstairs and when you heard her fall? Michael's jaw tightened almost imperceptibly. I told you already, 5 minutes. Maybe 10. I wasn't timing it. And you were at the stove the whole time, cooking eggs? Yes, so you had your back to the basement door? I suppose so. The stove faces away from the door. Why does this matter? I'm just trying to understand the sequence of events. So Amanda went downstairs, you were cooking with your back to the basement, and then you heard a crash? Yes, a loud crash. Like I said, I heard her fall. And the basement door was closed? Yes, we keep it closed because of the cats. But you heard her fall through a closed door and over the sound of cooking? It was a very loud noise, doctor. Very loud, like something heavy hitting the floor repeatedly. Of course I heard it. And you said you didn't hear anything before the fall? No cry, no shout, no exclamation? Michael's expression was becoming guarded now, his friendly demeanor slipping, a hint of irritation creeping in. No, just the sound of her falling. Why are you asking me all these questions? What does any of this have to do with treating her? Shouldn't you be focusing on getting her into surgery instead of interrogating me like I'm a suspect in something? I'm not interrogating you, Mr. Preston. I'm gathering information for the medical record. Understanding the exact sequence of events helps us anticipate potential complications and provide better care. It's standard protocol for any trauma case, but that wasn't entirely true. I was looking for inconsistencies, for gaps in his story, for anything that might suggest this wasn't the straightforward accident he claimed it was. And I was finding them. Small things, subtle things, but they were adding up into a picture I didn't like. Before I could ask another question, there was a knock on the waiting room door. Dr. Chun, the neurosurgeon, entered. He was a man in his 50s with silver hair and steady hands, known throughout the hospital for his surgical skill and his blunt bedside manner. Mr. Preston? I'm Dr. Robert Chun, the neurosurgeon who'll be operating on your wife. Do you have a few minutes to discuss the procedure? Of course, yes, whatever she needs. I stood to leave, but Dr. Chun gestured for me to stay. Dr. Coleman should stay. He's part of the care team. Dr. Chun sat down in one of the uncomfortable chairs and pulled out a clipboard with consent forms. What followed was a detailed explanation of the surgery, a craniotomy to evacuate the subdural hematoma. He explained how they would drill several small holes in Amanda's skull, then use a saw to create a bone flap that could be lifted to access her brain. He explained how they would remove the accumulated blood that was compressing her brain tissue, check for any active bleeding sources, and then replace the bone flap and close the incision. He talked about the risks, going through them methodically: infection at the surgical site, bleeding during or after the procedure, stroke from manipulation of brain tissue, seizures, blood clots, cerebral edema, damage to surrounding brain structures, permanent neurological deficits including paralysis or speech problems, or personality changes. He discussed the recovery process: at least a week in the ICU, possible need for rehabilitation afterwards, potential for long-term cognitive impairment, possibility that she might not be the same person she was before the injury. Michael listened intently, nodding at all the right moments, asking intelligent questions about surgical technique and post-operative care. He was playing his role perfectly, the concerned husband, engaged and informed, wanting to understand everything that would happen to his wife. Do you have any other questions? Dr. Chun asked when he finished his explanation. Just one, Michael said, his tone casual, almost offhand. What's the cost of all this? The surgery, the ICU stay, all of it? There was a beat of silence. Dr. Chun blinked, clearly taken aback. It wasn't a question most family members asked when their loved one needed emergency brain surgery to survive. Usually, the first questions were about chances of survival, quality of life after surgery, timeline for recovery. Cost rarely came up until much later, until after the patient was stable and people started dealing with the practical realities of medical bills. The cost? Dr. Chun repeated, his voice careful. Yes, I need to understand what we're looking at financially. We have insurance, of course, but I need to know what the out-of-pocket expenses will be. Our deductible, co-insurance, any out-of-network fees. Dr. Chun exchanged a glance with me, and I saw the same wariness in his eyes that I was feeling in my gut. The cost varies depending on complications and length of stay, Dr. Chun said slowly, his tone becoming guarded. But surgery like this is typically covered by insurance. You mentioned you have insurance? Yes, good insurance through my company, but there's always out-of-pocket costs. Deductibles, copays, percentages. I need a ballpark figure. I'm a financial analyst, doctor. I'm comfortable with estimates. Just give me a rough number so I know what we're dealing with. Dr. Chun's jaw tightened almost imperceptibly. I'm not sure of the exact amount. The billing department can give you a detailed estimate. Ballpark, doctor. That's all I'm asking. Just a rough order of magnitude. There was a long pause. Dr. Chun's expression had gone from surprise to guarded to something harder, colder. For the surgery itself, with anesthesia, operating room time, and neurosurgical team, probably $15,000 to $20,000 out of pocket after insurance. The ICU stay could add another $10,000 to $30,000 depending on how long she needs intensive care and whether there are complications. Post-operative imaging, medications, potential complications that require additional procedures, all of that would be additional. So you're probably looking at anywhere from $30,000 to $70,000 out of pocket, possibly more if there are significant complications. Michael was quiet for a long moment, his eyes on his hands, which were folded in his lap. When he spoke, his voice was cold, calculating, completely devoid of the emotion he'd been displaying just moments before. So we're potentially looking at $50,000 or more, possibly significantly more. That's a rough estimate, yes. But Mr. Preston, your wife is 34 years old. She has her whole life ahead of her. With surgery, she has a good chance of recovery. What happens if she doesn't have the surgery? Michael interrupted, his voice flat, emotionless. The ICU waiting room went silent. Dr. Chun and I stared at Michael Preston. Somewhere in the hospital, a phone was ringing. Someone walked past in the hallway outside, their footsteps echoing. But in the waiting room, there was absolute silence. "I'm sorry," Dr. Chun said, his voice dangerously quiet. "If we don't do the surgery, if we just keep her comfortable on the ventilator, what happens then? What's the natural course?" Dr. Chun's expression went from shock to coldly furious. "Mr. Preston, without surgery, your wife will die. The bleeding in her brain will continue, the pressure will build, and she'll either have a massive stroke or her brain will herniate through the foramen magnum at the base of her skull. Either way, she'd be dead within 6 to 12 hours without surgical intervention. But she's on life support now, correct? The ventilator is breathing for her." "Yes, but so we could just keep her comfortable. Make sure she's not in pain. Let nature take its course instead of subjecting her to an expensive, invasive surgery that might leave her with permanent brain damage anyway. She might wake up unable to walk or talk or even recognize her own face in the mirror. Is that really a life worth living?" I felt like I'd been punched in the stomach. The rage that had been simmering in my chest since I'd reviewed her x-rays exploded into something white-hot and barely controllable. "Mr. Preston," I said, my voice tight with the effort of staying professional, of not shouting, of not grabbing him by his expensive shirt and shaking him. "Are you seriously suggesting that we let your wife die because the surgery to save her life is too expensive?" Michael turned to me, his expression utterly calm, utterly composed, utterly rational, like we were discussing stock portfolios or interest rates instead of his wife's life. "I'm suggesting that Amanda and I have had conversations about quality of life, about end-of-life care, about what kind of medical interventions we'd want if we were ever in a situation like this. She's always been very clear that she wouldn't want to be kept alive artificially. She wouldn't want to be a burden on our family. She wouldn't want us to go into massive debt, to potentially lose our house, to destroy our financial future for a procedure that might leave her unable to function as an independent person. This isn't end-of-life care." Dr. Chun said, his voice hard with barely suppressed anger, "This is acute trauma care. This is a treatable injury in a young, otherwise healthy patient. This isn't a terminal cancer patient or someone with advanced dementia. This is your 34-year-old wife who fell down some stairs. With surgery, she has a 60 to 70% chance of good neurological recovery. Without it, she has zero chance." "Nevertheless," Michael said, his tone still maddeningly calm, still utterly rational, "I need to think about this. I need to weigh the costs and benefits. I need to consider what Amanda would want if she could speak for herself. And I need to talk to our insurance company about coverage details, about what's covered and what isn't, about our out-of-pocket maximums and deductibles. I need to understand the full financial picture before I can make an informed decision." "There's nothing to think about," Dr. Martinez said from the doorway. None of us had heard her enter, but she was standing there now, her arms crossed, her expression cold with fury. "Your wife is dying. She has a treatable injury. We can save her life. Every minute we delay increases the risk of permanent brain damage or death. This isn't a financial decision, Mr. Preston. This is a life or death decision. And as her husband and her medical power of attorney, it's my decision to make," Michael said, standing up, straightening his jacket, adjusting his expensive watch. "I understand that you disagree with my approach, but legally, I have the right to make medical decisions on my wife's behalf when she can't make them herself. And I'm making the decision that I believe she would make if she could speak for herself. No surgery. Comfort care only. A few hours might be too late," I started. "Then I suggest you keep her comfortable in the meantime," Michael said coldly. He looked at his watch again, that Rolex catching the harsh fluorescent light. "I have some calls to make. I'll be back in a few hours with my final decision." He turned and walked toward the door. At the threshold, he paused and looked back at us. "And before any of you get any ideas about going around me or questioning my authority to make this decision, I want you to know that I've already spoken with my attorney. I know my rights. I know what I'm legally entitled to do. And if any of you try to operate on my wife without my consent, I will sue this hospital. Personally name each of you in the lawsuit and make sure you never practice medicine again. Do we understand each other?" He didn't wait for an answer. He walked out of the waiting room, his footsteps echoing in the hallway, and disappeared. The three of us, Dr. Martinez, Dr. Chun, and I stood there in stunned silence. "What the hell just happened?" Dr. Chun finally asked, his voice shaking with rage. "Did he seriously just walk out and leave his wife to die because he doesn't want to pay for surgery?" "He's letting her die deliberately," Dr. Martinez said, her voice shaking not with rage but with a deeper, colder fury. "This isn't about money. A man who wears a Rolex and drives, what did the paramedic say he drives?" "BMW," I said quietly. "They mentioned it when they were giving report. Said he'd followed them in a new BMW 7 Series. A man who wears a Rolex and drives a $70,000 car doesn't refuse to pay for his wife's brain surgery because of cost. This is about opportunity. He tried to kill her once by pushing her down those stairs. Now he's trying to finish the job by denying her medical care. And he's using the legal system, using his rights as her husband, to do it. We can't let this happen," I said, my hands clenched into fists at my sides. "We have to do something. We can't operate without consent," Dr. Chun said, frustration evident in every word, in the tightness of his jaw, in the way his hands were also clenched into fists. "Unless she's incapacitated and there's no one to give consent on her behalf. But we have a husband, and he has medical power of attorney. His refusal, however morally reprehensible, however disgusting, is legally binding. We have no grounds to override him. Then we find another way," Dr. Martinez said decisively, her mind already working through options, through possibilities. "We find another family member who can override his decision. We petition the courts for emergency guardianship. We do whatever it takes. Coleman, check her emergency contacts in the medical record. See if there's anyone else, parents, siblings, anyone who might have legal standing to challenge the husband's decision." I pulled out my tablet, my hands shaking with anger and adrenaline as I navigated to Amanda's emergency contact section. There, in the list, were 2 entries: Michael Preston, husband, primary contact, relationship, spouse; Julia Preston, sister-in-law, secondary contact, relationship, husband's sister. "She has a sister-in-law," I said, already reaching for my phone with my free hand. "Michael's sister, Julia Preston. Call her," Dr. Martinez ordered. "Tell her what's happening. Tell her Amanda is dying and her brother is refusing to authorize life-saving surgery. See if she can help us. See if she knows anything about their relationship that might explain why he's doing this. And if she can't help, then we go to Plan B, emergency court order. But let's try this first. Call her now." I stepped out of the waiting room into the quiet hallway, my heart pounding, my hands shaking as I dialed Julia Preston's number. It rang once, twice, 3 times. I was preparing to leave a voicemail, trying to figure out what I could legally say in a message about a patient's condition, when a woman's voice answered, slightly breathless, like she'd run to catch the phone. "Hello, is this Julia Preston?" "Yes, who's calling?" "This is Dr. Marcus Coleman from St. Halsted Hospital. I'm calling about Amanda Preston. She's your sister-in-law, correct?" There was a sharp intake of breath on the other end of the line. "Oh my God, is she okay? What happened? Is she hurt?" "Miss Preston, Amanda was brought to our hospital this morning. She's been in an accident. She fell down a flight of stairs at her home. She's alive, but she's in critical condition. She has a brain injury that requires emergency surgery to save her life." I paused, choosing my next words carefully, knowing that what I said next would either help or doom Amanda Preston. "Your brother Michael is her husband and has medical power of attorney, and he's refusing to consent to the surgery that would save her life." There was a long pause on the other end of the line. I could hear her breathing, could almost hear her mind working through what I just told her, processing the implications. When Julia Preston spoke again, her voice was different, harder, more controlled, cold with a fury that matched what I was feeling. "I'm sorry, did you say Michael is refusing to consent to surgery? Surgery that Amanda needs to survive?" "Yes, ma'am. He says it's too expensive and that Amanda wouldn't want the financial burden on the family. Another pause, longer this time. I could hear her breathing quicken, could hear the sound of movement, like she was already gathering her things, already heading for her car. Doctor, I need you to tell me everything. What are her injuries? How bad is it? What exactly did Michael say? I gave her a clinical summary, keeping my voice professional despite the rage burning in my chest. Subdural hematoma, fractured ribs, collapsed lung, broken arm, the urgent need for surgery. Michael's cold calculation of costs. His decision to think about it. His threat to sue if we operated without his consent. And there's something else, I added, my voice dropping lower even though I was alone in the hallway. We found evidence of multiple old fractures, healed injuries that were never properly treated, injuries scattered throughout her body. The pattern is consistent with long-term physical abuse. Julia Preston was quiet for so long I thought the call had dropped. I pulled the phone away from my ear to check if we were still connected. We were. She was just silent, processing, thinking. When she finally spoke, her voice was thick with emotion, rage and grief and guilt all mixed together. Doctor, I need you to listen to me very carefully. I'm getting in my car right now. I'm leaving my house right now. I'll be at the hospital in 30 minutes. I'm in Oakmont, so it's about a 25-minute drive, maybe 30 with traffic. Don't let Michael make any decisions until I get there. Please, I'm begging you. Don't let him take her off life support. Don't let him refuse surgery. Just stall him, keep him away from her. Do whatever you have to do. Please, I'll do what I can. But Miss Preston, can I ask you something? You don't sound surprised that your brother is refusing treatment for his wife. Is there a reason for that? Julia's laugh was bitter, harsh, full of pain and self-recrimination. Doctor, I've been waiting for this phone call for 2 years. I knew one day Michael was going to go too far. I knew one day he was going to try to kill her. I knew this day would come eventually. I didn't think it would be like this. I thought when it happened, when he finally went too far, it would be obvious. That everyone would be able to see what he'd done. But this pushing her downstairs and then pretending to be the concerned husband while he lets her die, this is perfect for him. He's going to get away with murder and everyone will think he was just trying to honor her wishes. My blood went cold, ice spreading through my veins despite the warm hospital air. Miss Preston, are you saying your brother has been abusing Amanda? That this fall wasn't an accident? I'm saying my brother is a violent, controlling psychopath who's been systematically destroying my sister-in-law for 3 years. I'm saying I've tried to help her, tried to get her to leave him, tried everything I could think of. I'm saying she called me 2 nights ago, crying and terrified, and told me she was finally ready to leave. And I'm saying that less than 48 hours later, she's in a coma with a brain injury, and Michael is refusing to save her life. She paused, and I could hear her voice break, could hear tears she was trying to suppress. And I'm saying that if Amanda dies because Michael refused to pay for surgery, it's not an accident. It's not a tragedy. It's murder. Premeditated, calculated murder. And I should have stopped it. I should have done more. I should have, Miss Preston, I interrupted gently. None of this is your fault, but I need you to tell me everything when you get here. Everything you know about their relationship. Every conversation you had with Amanda. Every text message, every phone call, every suspicion. We're going to need all of it. For what? To petition the court for emergency guardianship. To override Michael's authority. To give us legal permission to do the surgery without his consent. Can you do that? Can you provide documentation? Statements? Evidence? Yes, God, yes. I have text messages going back months. I have photos of bruises Amanda sent me when she was scared. I have voicemails. I have everything. I kept everything because I knew one day I'd need it. I knew one day I'd need proof. Good. Bring all of it. And Miss Preston, drive safely. We need you here in one piece. I'll be there in 25 minutes. Don't let him kill her before I get there. The call ended, and I stood in the empty hallway for a moment, processing everything Julia had told me. Then I went back into the waiting room to find Dr. Martinez and Dr. Chun. The sister-in-law is on her way, I said. And she just confirmed what we suspected. Michael Preston has been abusing Amanda for years. Amanda called her 2 nights ago and told her she was planning to leave him. Less than 48 hours later, Amanda is in our ICU with injuries that look suspiciously like they came from more than just a fall downstairs. That son of a bitch. Dr. Chun said quietly. That absolute son of a bitch. We need to call the police, I said. File a report. Get them investigating while we deal with the medical side. Already done, Dr. Martinez said, holding up her phone. I called them while you were talking to the sister. They're sending detectives from their domestic violence unit. They'll be here within the hour to take statements and review the medical evidence. What about the court order for emergency guardianship? I'm on the phone with the hospital's legal counsel now, she said, gesturing to her other hand where she was holding her cell phone. They're preparing the paperwork. But Coleman, this is going to be an uphill battle. Convincing a judge to override a husband's medical power of attorney in a matter of hours? That almost never happens. We need overwhelming evidence. We need documentation. We need Julia Preston to arrive with everything she has. She said she has text, messages, photos, voicemails, everything. Good, because without that, without rock-solid evidence that Michael Preston is not acting in his wife's best interest, no judge is going to override his decision. No matter how much we all know he's trying to kill her. The next hour was a blur of activity. Dr. Martinez coordinated with the hospital's legal team, who were frantically preparing an emergency petition for guardianship. I stayed by Amanda's bedside in the ICU, monitoring her vital signs, watching helplessly as her intracranial pressure continued to climb. The monitor showed the numbers in stark, unforgiving digits. 18 mmHg, then 20, then 22. Normal ICP should be below 15. At 25, we'd start seeing serious, potentially irreversible neurological damage. Rita, the experienced ICU nurse, came in every 15 minutes to check Amanda's pupils, to assess her neurological status, to document any changes. Each time, she shook her head grimly. Right pupil is getting more sluggish, she reported during one check. Left is still blown. ICP is climbing 23 now. She needs surgery soon, Dr. Coleman. Not in a few hours. Soon. I know, I said, feeling helpless, feeling the weight of Amanda's life slipping away minute by minute while we fought legal battles instead of medical ones. We're working on it. Work faster, Rita said bluntly, her voice carrying the weight of 20 years of experience. 20 years of seeing patients die because of bureaucracy and legal complications and families who didn't do the right thing. Because in another hour, maybe 2 at most, it won't matter what you do. The damage will be too extensive. She either die or she be so brain damaged that she'll never be herself again. The clock on the wall seemed to move in slow motion. Each second felt like an eternity. Each minute that passed was another minute of brain cells dying, of pressure building, of Amanda Preston slipping further away from us. At 2:15 p.m., Julia Preston arrived. I saw her through the ICU glass doors before she entered, a tall woman in her early 40s, dressed in a business suit like she'd left work in the middle of the day. Her dark hair was pulled back in a severe bun. Her face was pale but set with determination. She looked nothing like Michael, where he was smooth and polished and charming. She was sharp and angular and intense. Where his eyes held calculation, hers held barely suppressed fury. She pushed through the doors and stopped when she saw me standing at the nurse's station. Dr. Coleman? Yes, you must be Julia. Where is she? Where's Amanda? This way. I led her to bed 7, where Amanda lay unconscious, surrounded by machines and monitors. When Julia saw her, she made a sound something between a gasp and a sob, a sound of grief and rage mixed together. She moved to the bedside, her hand trembling as she reached out to touch Amanda's arm. "Oh, Amanda," she whispered, her voice breaking. "What did he do to you? What did that monster do to you?" She stood there for a long moment, just looking at Amanda, tears streaming down her face. Then she wiped her eyes, straightened her shoulders, and turned to me with an expression of cold determination. "Okay, tell me what you need from me. Tell me how I can help save her life."